Conference on October 1, 2024, under the theme One Earth, One Health and Healthcare Beyond Boundaries. This vision was articulated by the Prime Minister of India during India's G20 presidency in 2023, aimed to strengthen global health ecosystem by ensuring quality, affordability and accessible healthcare for all. The conference brought together all key stakeholders on a single platform to address and share insights on healthcare challenges and solutions and showcase India's efforts in bringing health gaps globally, with a special focus on developing countries, particularly in Africa. Participants of the conference are among others the government of Ethiopia, the United Nations and other international organizations, health sector professionals, pharma and medical device manufacturers. The conference was officially inaugurated by His Excellency Mr. Anil Kumar Rai, Ambassador of India to Ethiopia and Permanent Representative to the African Union.
Africa has always been very close to India, which is reflected in the path-breaking initiative taken by India for securing a permanent seat of African Union in the G20 during our presidency last year. Today we have the opportunity to listen to the key stakeholders from the host government, from the international organizations, and we have presence of roughly 25 Ethiopian hospitals here and a large number of clinics. Similarly, we have 10 hospitals from India who are represented here, and there are a large number of professionals who are here. The healthcare infrastructure of India has grown in all its dimensions, and it is poised to reach $600 billion valuation by this year. We have dedicated $85 million to do specific research, and the World Health Organization has opened Global Center for Traditional Medicine in the western part of India by a city called Jamnagar in Gujarat. Africa being rich in traditional ecosystems, and they have these kind of systems which are very much entrenched into their populations, they can of course use it. I am very happy to tell you that as of now, 25 countries including USA, UK, Switzerland, Germany from the west, and from the African continent it is South Africa and Mauritius. They have also integrated Ayurveda into their healthcare systems.
During the conference, Friyot Abebe, State Minister of Health of Ethiopia for Resource Administration and Regulatory, shared her views.
The vision of our health sector is to create healthy and prosperous Ethiopia. This is realized through comprehensive health promotion, disease prevention and treatment initiatives. And this grows health coverage contribution to the increasing in life expectancy. The health sector also contributes to the global health security. We have developed antimicrobial stewardship guidelines and strategies in line with the global One Health strategy approach in collaboration among the health environment and also the agriculture sector.
Mr. Mansour bin Musalama, Secretary General of the OSC, the Organization of Southern Cooperation, which embraces 28 member states from the Greater South, also delivered his valuable insights on the conference.
Ladies and gentlemen, allow me first and foremost to start by expressing my profound gratitude to the Embassy of India and in particular to its ambassador, acknowledging as well the excellence of the initiative of Prime Minister Modi during the G20 presidency of India with regards to One Earth, One Health. And of course, acknowledging the extraordinary work of the ambassador who has joined us here in Addis Ababa for what is a relatively short period, but that has, in that very short period, demonstrated that he is the right man in the right place at the right time. That we achieve a world in the south, just as in the north, with equitable access to health, with quality healthcare, as the basis for development. And of course, the first of these lessons, I believe, ladies and gentlemen, is the issue of access. The issue of access, because you will all recall, and Your Excellency, you will recall far better than I, and the healthcare professionals here as well. I am entirely aware, Your Excellencies, ladies and gentlemen, that COVID-19 appears to be a lifetime ago. Yet we are only just emerging from this experience, and we have a duty as countries, we have a duty as international organizations, we have a duty as healthcare professionals to learn all the lessons of COVID-19.
Among the high-profile dignitaries attended the conference are Dr. Ramiz Alakbarov, Assistant Secretary General of the United Nations and Resident and Humanitarian Coordinator for the United Nations Office in Ethiopia.
Personal experiences as they relate to the important contribution which the government of India has provided globally to the global health. And in my previous jobs, I have spent about a quarter of a century working for the United Nations Population Fund, one of the major health service providers. I can testify that from the 90s, our supply lines and procurement of equipment, ultrasound devices, which at that time were a luxury, they're largely concentrated from affordable and quality suppliers in India, where indeed, as His Excellency Ambassador noted, the private sector has made a considerable progress in making high technology and high quality equipment and services available to the population. And it is thanks to those supplies that we were able to reach to so many countries across the continent and across the globe with those important elements. Unfortunately, to tell you that humanitarian flows around the globe have gone considerably down. If in the past we were able to mobilize $2 to $3 billion a year to provide humanitarian assistance, which included the area of health, we will not be able to provide even $1 billion this year. This is a reflection of a global downward trend. As we look at the downward trends, we also should embrace this challenge with a new look. Less resources doesn't mean that we need to remain helpless in the face of the challenge and ask for more money. We have to find new ways of working.
The conference that brought together all stakeholders on the single platform addressed the major healthcare challenges and solutions and showcased India's efforts in bringing health gaps globally, with a special focus on developing countries, particularly in Africa. For such reason, various insight has been raised from the participants and fruitful discussion were held. The event also invited various local media houses and information were disseminated across Ethiopian media platforms.
Now Ethiopia is the member of BRICS, so it has emerged as a very important platform. We are coming with BRICS Health Ministers Declaration. So collectively we are ready to work with Ethiopia, and bilaterally we are working with Ethiopia. So of course the priority area is every aspect of health. May it be joint production of medical equipments, pharmaceutical products. Already 5 Indian pharma companies are producing in Ethiopia. So we want that once the market gets stabilized, then Indian healthcare professionals comes and establish hospitals in this country.
ከህንድ ኤምባሲ ጋር በመሆን በህንድ ሀገር ያሉትን የተለያዩ የጤና አገልግሎት ስርዓት ውስጥ በሀገራችን ጋር አብሮ ሆኖ በዓለም አቀፍ ጤና ውስጥም ድርሻ ሊኖራቸው የሚችሉ የኛን ሀገር ጤና አገልግሎትም ከማጠናከር ደረጃ ድርሻ ያላቸው አካላት ጋር ነው ውይይት እያደረግን ያለ ነው። በዚህ ውይይት ላይ እንግዲህ ትልቅ ትኩረት እያደረግን ውይይት የምናደርገው እንግዲህ እንደ ሀገር ጥራት ያለውን የጤና አገልግሎት ፍትሃዊ በሆነ አግባብ ተደራሽ ለማድረግ ትልቅ ርብርብ እያደረግን ነው ያለ ነው።